Hello, this is Andrew Kohlmeyer at Andrew Kohlmeyer Medical Massage, and today I would like to talk about the medical massage approach for treating irritable bowel syndrome. So what happens with irritable bowel syndrome is you have a pelvic floor dysfunction. Your pelvic floor is too tight, possibly mineralized, and this leads to a clenching of the pelvic floor. This can happen from people who have to work in a workplace environment where they have to stand on their toes, like they're a hairdresser or whatever, where they're working out of position and have to work on their tiptoes. That is an easy way to start this process of having that tight pelvic floor, which can lead to irritable bowel syndrome. So to relieve that, you first, well, you want to start to get the pressure off of the pelvic floor. So to do that, you want to make sure that their lymphatics are flowing back up to their heart more efficiently. So basically the legs drain into right here. This is called the cisterna chyli at vertebrae L2, and then it goes up this thoracic duct to the subclavian veins in the shoulder here, and then into the heart. So to do that, you want to have a little bit of space between the vertebrae, and this is going to start to drain the pelvic floor up through into the cisterna chyli. So it's also important to note that people wear clothing and your body fights off everything that it comes in contact with. So they'll have a clothing line mark basically in their body where you can palpate that dense tissue in the pelvic into the hip. So this fills up the legs, and then in turn the pelvic floor becomes really engorged. Sometimes it comes up from the knee, so you have to address knee issues, specifically the medial knee at the pes ansterine. You want to make sure the muscles coming up there are not causing inflammation into the pelvic floor. Specifically, gracilis is a really good one to cause that because it just goes right up into that pelvic floor. But mainly, if you take the pressure off, here without even really addressing the knee so much, that they'll still get some benefit. And basically, the mechanism of that is you're cutting off proper nutrition to the bowel. So when the pelvic floor is clenching and it's really, really tight, you just, cellular turnover in the bowel is really fast. So if you're disabling that mechanism, you're really going to lead to symptoms where the bowel isn't exactly healthy tissue anymore. So it's, it can really lead to problems with, your bowel. Like you have to go to the bathroom more and all kinds of stuff like that, unpleasant stuff. So basically, to get this drained, you have to get the fluid out of the legs, out of the pelvic floor to L2. So that involves, making sure that you have a pathway along the vertebral borders here for that to physically drain. It just drains just like any other drain into the structure of, the thoracic duct, the cisterna chyli, and then it goes to the heart and out of the body through urination. So to do that, you want to, you're going to push down in here. You want to, get a lower density into the tissue here so that mechanism happens. And what also is a really good way to get this out is I use a wooden tool. This is a potato masher. I don't know what you call it, something like that. And you would just, use that. You could feel, it's like the hip joint is here, so you can feel like down in there. It's like, oh, that's really gonna help. It's like you can feel so much density there between, like I said, like the clothing line and just life in general. People tend to have, obviously tight hips. It'll mineralize there. You want to dig that stuff out as well. But it just really, really gets the fluid out. Like, and you can run down the leg with it. All that, and it just kind of just steamrolls the fluid out and gets it, enables it to be processed by the cisterna chyli at L2 and then up that thoracic duct. So, you can get in here too, and get right into the pelvic floor You'll feel the sacral border here. Let me draw some of that in. So you'll have the sacral border, which is like a triangle. You'll feel that, and you want to get all along that triangle, the border of that cleaned up. So you can get in there with a tool like this, and you can keep modesty and all that, and it's but once you get down in there, it's they're gonna do way better as far as the health of their colon and rectum. It's just so that'll be just such a beneficial thing for people. It's just like it's I see the distress of people coming in with that. It's just like it's really is a very large dysfunction in their life to have to worry about, okay, where's the bathroom in this building? They need to get that exit plan to handle those symptoms. So it's really not that complex. You can see how easy it is. The legs draining into the cistern and chyli, that's like the main thing to take. So if you do a good job with everything else, even without so much addressing the pelvic floor, like it's gonna happen. They will improve their pelvic floor. And there's also there's nerves in there that right in here which control your bladder. They're just right in here. So if it's really, really tight, they're going to have bladder dysfunction too. So you really want to solve that issue, which, like I said, is not complex. It's very simple. To palpate it, you can feel it's like, okay, that's not right. And you almost know by the profession, okay, they are a beautician or whatever, whatever job that you might think that, hey, there's a potential where they could be working on their tiptoes, or there's a height discrepancy to their job. They're either too tall or too short, which makes them work out of position, and their pelvic floor can be compromised. So that's about it. I hope this finds the right venue for someone that could be experiencing something like this, because wow, it is such a great thing to say, or to hear people say, like, I'm in remission from that irritable bowel syndrome. It's just incredible to have that. So all right, take care.